Hello and welcome. We're going to do the knee treatment today. So as most of the treatments that we do, we begin with rolling. So we're going to roll the hamstrings. And I'll have you watch me for a little while, but normally when we're doing the recipe, once we start rolling, I like to roll for about 10 minutes, so I don't think it would be beneficial for you to watch me roll for 10 minutes. Watch me roll a little bit, but maybe if you're practicing, you might want to put it on pause and give your the chance to really give it a good roll. So getting it medial and laterally. So I'm getting the hamstrings, behind the knee, the popliteal crease, gastrocs, and continuing to roll. So I always want to also roll all the joints in different positions. So you'll notice my rolling will switch to a different direction, and I want to come out, get the lateral side. And as always, this gallbladder channel, the iliotibial tract, is tight on so many people. So I want to come in and move it around as I roll on the iliotibial tract, down the leg, and open and close as you roll. So just moving the joint around as you roll. All right. So I'm going to come up here on the sides, all around the knee. It's really a lot of attachments right on the side, the collateral ligaments. So make sure you get all of those. All right. So now I'm going to knot. And when I knot, it's kind of, I think about getting the fascia all fluffed up and getting the blood getting through there, and think about fluffing up a pillow, getting it more air in it, more blood. All right. Okay, and I'm going to finger spring the bladder channel. So I'm going to start up at the thigh, and I'm going to go straight down. See my jiggle? Behind the knee, and down to bladder 57, right where the end of the two heads of the gastrocnemius is. And then I'll finger spring across the popliteal crease. And hang out in any areas that you feel called to hang out in. And then we're going to do the points. So it's really important. There's 3 points that go along the popliteal crease: kidney 10, urinary bladder 40, and urinary bladder 39. It's really important to have the knee flexed when you do them. It makes it much easier to receive. So I'm going to come in and get kidney 10 in between the two tendons of semitendinosus and semimembranosus, and then urinary bladder 40 right in the center, and then urinary bladder 39 on the medial side of the biceps femoris tendon, and then 55 too soon below 40, and then 57 between the two heads of the gastrocnemius. So that's the grouping on the posterior leg for the knee treatment. So again, kidney 10, urinary bladder 40, urinary bladder 39, urinary bladder 55, and urinary bladder 57. All right. Now here's the move that I really think is super beneficial. I use it all the time when I go to events working with people with knees. So I'm going to get my thumb on the medial side of the tendon of semitendinosus and semimembranosus. So my thumb is kind of in the center behind the knee, and then my fingers come around. So I'm actually, if my fingers were the tendon, then my thumb would be on this side, my fingers on this side, and I'm grasping and pulling and working those whole areas. And I'll keep my thumb as kind of the focal point, and I'll keep my thumb there, and then see how I come down and get here and get medial. It looks like it would not feel good. It feels real good. Knee treatments are one of my favorites just because I love getting my knees worked on. So good. And you can follow. So now I leave behind the knee a little bit and follow the tendon up, and I'm really going to do it on the other side. So here's the thing. I have to use my other hand because I want my thumb on the inside and my fingers on the outside. Some students go as far as to walk around to the other side of the table. I just find it just easier. I do have a little twist in my body, which isn't great body mechanics, but this is the way that I like to do it. And here we've got that lovely iliotibial tract where I can follow it up, follow it back, coming around, just all around the side, grasping those tendons. I'm getting the head of the fibula. All right. So now, I believe we're going to roll to finish up. Rolling. I really get that iliotibial tract again. Rolling. And I'm going to stop here and turn my client over and do the anterior part of the knee treatment. So now we've got our client turned over, and we're going to, again, take some time to roll, really get the hamstrings. I'm not going to move the leg when he's face out. That's a little bit too much, but really want to get the hamstrings, get the lateral side, come down. I think it feels really good all around the patella, even though it's a bony area. That's, I think, one of the best things about Tui Na is you roll right on top of a bone. It's crazy, and it feels so good. You can't do that with other techniques. It's just not the same. I'm going to come down, moving vicariously, wanting my knee to get work done. Taking your time, again, giving it a good amount of time. If you want to pause this and roll a little bit longer, I would be probably rolling longer just because it feels so good. It's really helpful. Just moving around. Okay. So now we've got spleen, stomach, and gallbladder. Spleen, stomach, gallbladder. So I'm going to gnaw. So be careful. Some people are ticklish in this. These 2 points here are spleen 10 and stomach 34. And also be careful on the gallbladder channel. That can be super sensitive on people. So go in. So I kind of like get spleen and stomach and then drop down and get stomach and gallbladder. So going down and really, especially like to get right along the fibularis longus and brevis. Get in there. Gnaw feels really good, but it does take a lot of strength. It takes time to build up the ability to gnaw for a while. Okay. All right, and now I'm just gonna go right into 5 tigers, lift the lamb. So these are my 5 tigers. And again, some people are really squeaked out about their patella being moved around. So I always honor anyone's boundaries if that's a problem for you, but honestly, I usually come right in here and I like to lift the patella up and slide it back and forth and up and down. It's supposed to move. But some people's patellas are hypermobile, so in that case you would have to be careful with it. But the thing that I also really like to do is get my thumb and pin it right on the patellar ligament between just above the tibial tuberosity, and just go in and give that tendon a really nice little cross fiber. Oh, it feels so good. Okay. So now we're going to go into pressing points. So I'm sure you spent time studying the points, so I'm going to go through the points and call them out, but I'm not going to be, describing in detail where they are, because you'll just spend your time at another point. So I'm going to start with spleen, so spleen 6. And this could be a press rub, it could be on, so on is press, release, press, release. I usually end up doing a press rub. So then spleen, this is spleen 6, going to spleen 9. And then spleen 10. And now stomach, 34. Stomach, 35. And stomach, 36. And then gallbladder. So I'm going to do gallbladder 34 first, because I use gallbladder 34 to find gallbladder 33. And I would check in and ask my client if any of the points were ashi, and I could go back and work on those points. But generally what I do is I work the points and do a whole cycle, and then do several different cycles so that I get the points a lot. So I'm going to do it twice. I'm not going to call it out. Well, yeah, I'll call it out. So spleen 6, spleen 9, spleen 10, stomach 34, stomach 35, stomach 36, and gallbladder 34, and gallbladder 33. All right, so getting all those points. After I press points, I'm going to just kind of either roll or light knee. I think I want a light knee on the medial side. And kind of roll on the lateral side. So anytime I press points, I always like to make nice after that. Just like, yeah, I know that was pretty stimulating, but it's going to feel better. And again, go back and work any ashi points that your client has. Okay. So now the passive joint movements for the knee. Again, when we do in Tui Na, we give you like a broad spectrum of things that you can choose to do, and some of the moves. So if I had someone who had a very unstable knee, then I would want to maintain what stability there is. So I may not do a lot of these passive joint movements. I might just stick to point work and rolling. But if you have someone that's got possibly a lot of crepitus in their knee, or just scar tissue, and you want to break all of that stuff up so the knees moves better, then these moves are awesome. So the first one we're going to do, so the knee's going to be flexed, and if you look at my wrist right here, so I'm going to start with my thumb up, and I want the back of his knee close to my wrist as possible. And then notice when I rotate my palm down, I've gone from my finger being an inch and a half apart, and then I rotate, and then they're 2 inches apart. So what's happening is I'm actually tractioning the tibia away from the femur and creating more space in the joint. And it does take a little bit of strength. If someone does have crepitus in their knee, it usually feels really, really good. If you're practicing on a really healthy knee, then it's going to feel like their gastrocs getting squashed. So just remember when you're practicing, you're practicing, and the person may not necessarily, your partner that you're working with may not necessarily need the work, so their feedback might be a little bit different than if we were actually working on an injury. So I'm going to come in, I get in my bow stance, I get my thumb way up in the knee, and then this hand is on the ankle, and I'm going to push as close to the ischial tuberosity as I can, really use my force. And then it's going to take some effort to rotate your palm down like that. Hold, and then release. And then I might do that 3 times and rotate, unless they said, oh, ow, that's too much. And I would not. Okay, let's do that one more time. And rotate. All right. This next one, again, it does take a lot of strength, especially with your thumbs. So what I'm going to do is I'm going to start with the knee inflection. And you want to find the patellar ligament, and you're going to place your thumbs on either side of the patellar ligament. There's little pockets on either side there. And so what we're going to do is we're going to pin the patella so that it actually has to track correctly through that groove in the femur. And you'll definitely, if someone has crepitus, you will definitely hear popping and crackling, and so don't be surprised if when that happens, because it happens. And my fingers are kind of curled up, really supporting the back of his knee, and I'm going to pin it down. I have to lift his leg up and then slowly extend the knee. And again, don't be surprised if you hear some crackling. So we do that a couple of times. Are you okay? Okay. Now, this next one feels really good. I had students in class, that one student in particular who had a hypermobile knee, and she saw me do this and she just went, oh, she's just like, oh my God, don't do that to me. So you're going to be surprised how good it feels. So I'm going to hold at the calcaneus. I'm going to lean back with a little tiny bit of traction just to give me some strength, and then I'm just going to bounce the back of the knee off the table. You're at the back of the knee, hit the table. So the knee can't hyperextend because the table's in the way, but it's totally understandable if someone has a. All right. So if you don't want to do that one, this next one is fun. I'm going to get my thumbs on either side of the patella and wrap my fingers around, so like I'm wrapping around the head of the femur. And then you shake it as much as you can. So hold on and just shake. And it feels really good. You'd be surprised, but it feels like a lot of work too. But it feels really good. So usually someone encourages me and says, oh yeah, that feels good, then I'll go a little bit longer with the encouragement. How's it going?
Really good.
All right. All right. Ah, there we go. Roll the leg. Rolling. All right. So again, you can take more time rolling, but that is the knee treatment. So thank you.